I'm here to talk about prevention of a condition called gluteal fibrosis. We can prevent this condition at 3 levels. The first level is called primary prevention. The second is secondary prevention, and the third is tertiary prevention. So in primary prevention, you want to prevent the children from getting intramuscular injections. Okay, how do you prevent that? You prevent that by health educating them about avoiding falling sick, by using probably a bed net or mosquito net. So when they do that, they wouldn't fall sick and they wouldn't require any form of injection. Secondly, you can do this by educating the health workers and telling them to avoid toxic injections to the muscles. When they prevent this from happening, then these children will not get this condition called gluteal fibrosis. In the part of secondary prevention, once the gluteal fibrosis has occurred and these children cannot squat, cannot sit upright in class, cannot bend down to bathe, cannot squat when using a toilet or pit latrine, you prevent this condition by treating it. That means by releasing the contracture in the gluteal area. Once you release that surgically and offer physiotherapy, then you'll be preventing the condition by treating what has already happened. That's the second level of prevention. And then the tertiary level of prevention is you manage the complications of what has been treated. If there are any complications occurring after surgery, then you manage the complications. So all these 3 strategies should be used in preventing this condition called gluteal fibrosis.
Gluteal fibrosis is a condition that is got as a result of children getting very many injections on the gluteal. And the injections are given incorrectly. Instead of putting in the outer upper conduct of the buttock, it's put in the middle where it is not the right place. And because of the many injections, the tissue becomes fibroized, and the buttock, as the child is growing, fails to grow up in the right shape. So the child will fail to squat, will fail to walk properly, will walk whilst the legs are a little paralyzed. When the child is going to the toilet, the child has difficulty in passing stool in the toilet because the one leg has to be put aside inside of squatting very well. The bad practice, most of these children get this gluteal fibrosis from the clinics. In the clinics, the staff who are working in the clinics, they are not well-trained staffs because the trained staffs are working in the hospital. In the hospital, like the quinine injection, we are supposed to give a child intravenous, which is diluted in 5% dextrose, depending on the kilogram body weight of the child. But in the clinic, it is given intramuscular, and even the dilution may not be well diluted. And this causes the concentration of the quinine with the repeated injections causes the fibrosis to occur.
Gluteal fibrosis is a condition that has mostly caused problems in Bugiri and Teso parts of Uganda. Gluteal fibrosis is a problem that causes more contractures on the gluteus maximus, and it is something that has come due to poor intramuscular injections by unprofessional staff. These children that present with this condition have the problems like external rotation of the hips, poor flexion of the hips, and functionally they fail to walk in upright postures, helping themselves in squatting while the hips are adducted. Those that I've mentioned will guide in the physical therapy rehabilitation after surgical intervention from the theater.